Hello, my name is David Porter. I'm an optometrist currently working inside the Costco in Danville, and I'm working on these videos. I've got a bunch already, and today I wanted to talk about this condition, posterior vitreous detachment. So this is basically something that happens on the inside of your eye. So this is kind of the domain of a retina specialist, and so I'd like to review two websites summarizing this condition that are published by retina specialists. This first website is ASRS.org, the American Society of Retina Specialists, and facts from the foundation of the ASRS Retina Health Series, Posterior Vitreous Detachment. Posterior vitreous detachment, PVD, is a natural change that occurs during adulthood when the vitreous gel that fills the eye separates from the retina, the light-sensing nerve layer at the back of the eye. Symptoms are floaters or mobile blurry shadows that obscure the vision, and flashes or streaks of light, usually at the side of the vision. These symptoms usually become less intense over several weeks. Most patients experience PVD after age 60 once in each eye, and the condition is usually non-sight threatening, but occasionally affects vision more permanently in the event of complication, such as a retinal detachment or an epiretinal membrane. So what is the retina? It's a thin layer of light-sensitive nerve tissue that lines the back of the eye or vitreous cavity. When light enters the eye, it passes through the iris to the retina, where images are focused and converted to electrical impulses that are carried by the optic nerve to the brain, resulting in sight. Symptoms in detail: mild floaters in the vision are normal, but a sudden increase in floaters is often the first symptom of PVD. During PVD, floaters are often accompanied by flashes, which are most noticeable in dark surroundings. Most patients experience floaters and flashes during the first few weeks of a PVD, but in some cases the symptoms are hardly noticeable. If PVD is complicated by vitreous hemorrhage, retinal detachment, epiretinal membrane, or macular hole, the flashes and floaters may be accompanied by decreased or distorted vision. Floaters are most bothersome when near the center of vision and less annoying when they settle to the side of the vision. They may appear like cobwebs, dust, or a swarm of insects, or in the shape of a circle or oval called a Weiss ring. Causes: over time, the vitreous gel that fills the eye becomes liquid and condenses or shrinks due to age and normal wear and tear. Eventually, it cannot fill the whole volume of the eye's vitreous cavity, which remains the same size during adulthood, and so the gel separates from the retina located at the very back of the eye cavity. Over the next 1 to 3 months, the vitreous gel further condenses, and the sides of the gel also separate from the retina until the PVD is complete, and the vitreous gel is attached to the retina only at the vitreous base. Clear vitreous fluid fills the space between the condensed vitreous gel and the retina. If a PVD progresses gently, gradually, and uniformly, the symptoms are typically mild. However, if the forces of separation are strong or concentrated in a particular part of the retina, or if there is an abnormal adhesion sticking together between the vitreous gel and the retina, such as lattice degeneration, the PVD can tear the retina or a retina blood vessel. Flashes and floaters are typically more obvious when PVD is complicated by a retinal tear or vitreous hemorrhage. These conditions can lead to further complications such as retinal detachment or epiretinal membrane, which can result in permanent vision loss. However, about 85% of patients who experience PVD never develop complications, and in most cases, the flashes and floaters subside within 3 months. Risk factors: posterior vitreous detachment is rare in people under the age of 40 and increasingly common during advanced age. Additional risk factors for PVD include myopia, trauma, and recent eye surgery such as a cataract operation. Patients who experience PVD in one eye will often experience PVD in the other eye within 1 year. Diagnostic testing. Posterior vitreous detachment is usually diagnosed with a dilated eye exam. However, if the vitreous gel is very clear, it may be hard to see the PVD without additional testing, such as OCT or ocular ultrasound. Treatment and prognosis. PVD is non-sight threatening and the symptoms subside in the vast majority of patients. Most patients no longer notice flashes after 3 months, and floaters tend to improve. No specific treatment is needed for PVD. That said, complications of PVD are rare but can be serious and require urgent treatment, such as laser for a retinal tear or surgery for a retinal detachment. For this reason, 1 or more checkups are recommended within 3 months after the onset of PVD. In rare cases, the floaters from PVD persist, and vitrectomy surgery to remove the floaters is effective. You and your doctor may consider this after discussing the risks and benefits of surgery. So that is a literal reading of the website from the American Society of Retina Specialists. And this website is from Bay Area Retina Associates in the Bay Area. They have a list of retinal conditions. This is for posterior vitreous detachment. And it says the eye is like a camera. It has a lens in the front that focuses light and film in the back that captures light. The retina is the film inside the human eye and contains over 1 million neurons, as well as a network of blood vessels that keep the tissue healthy. Between the lens in the front and the retina in the back of the eye lies a clear gel called the vitreous. A posterior vitreous detachment is a separation between the vitreous gel and the retina. How does a PVD occur? At birth, the vitreous gel is clear and firm, and it is attached to the retina. With age, the vitreous gel becomes liquefied, and some of the proteins in the gel clump together. These are the small floaters that most people see. Eventually, the back surface of the gel may separate from the retina, beginning near the optic nerve and macula, and continuing toward the edges of the retina. The incidence of PVD increases with age. Most of the time, a PVD occurs without any sudden new symptoms. Some of the time, however, a PVD is marked by the sudden onset of new flashes or floaters in the affected eye. Posterior vitreous detachment usually occurs spontaneously, but may occur acutely in the setting of trauma. Flashes and floaters. As the separation of the vitreous gel from the retina moves from the center out toward the edges of the retina, the gel may pull on the retina at the leading edge. This traction on the retina may cause retinal neurons to fire, resulting in transient colorless flashes in the vision. Once the gel separates from the retina, clumps of protein on the back surface of the vitreous gel may be seen as large new floaters. Floaters in the setting of a PVD may also represent blood, hemorrhagic PVD, or pigment, both of which can be associated with a retinal tear. This is discussed more below. Hemorrhagic PVD. As the vitreous gel pulls away from the retina, the gel may tear a blood vessel on the retinal surface. A few drops of blood may leak out of the blood vessel into the gel and be seen as new floaters. While these floaters may be annoying, the blood generally does not cause any damage to the eye tissues. Hemorrhagic PVD is concerning because in the presence of blood, there is a high likelihood of a retinal tear. If a tear is present, the blood may obscure it, and so frequent, careful retinal examinations are appropriate in order to identify a retinal tear as early as possible and prevent a vision-threatening retinal detachment. In cases of dense hemorrhage that does not clear quickly on its own, surgery may be recommended to remove the blood and identify and treat the underlying source of bleeding. Retinal tear. When a PVD occurs with flashes or floaters, there is about a 10% chance of developing a retinal tear. Most of these tears occur within 6 weeks of the initial symptoms. Tears occur because of traction from adherent gel pulling on the retina. An untreated retinal tear may lead to a retinal detachment with severe vision loss. What to expect after a PVD occurs? Detailed examination by a retina specialist may be necessary after a PVD, depending on the findings at the time of the examination. The primary purpose of examination is the detection of a retinal tear, which would be treated without delay in order to prevent severe vision loss. This sometimes involves pushing gently on the outside of the eye to facilitate visualization of far peripheral retina through the dilated pupil. In most cases, the new floaters from a PVD will not go away entirely. However, the brain often learns to ignore the new floaters, and the floaters may become more mobile and move away from the central vision as the vitreous gel continues to liquefy with time. In cases of hemorrhagic PVD, the floaters may decrease over time as the blood breaks down and disappears. Flashes usually decrease and stop as the process of vitreous separation completes itself. This may take days, weeks, or even months depending on the characteristics of the gel. If you experience a sudden increase in flashes, onset of additional new floaters, or a shadow in the vision, contact your doctor immediately, as these may be symptoms of a retinal tear or detachment. So that is the information I'd like you to have about posterior vitreous detachment. And so we will dilate the eyes, we will do optos to look at the health of the inside of the eye, and if we see anything, we will get you into a retina specialist to be sure and promptly treat and prevent any long-term serious consequences. So that relates to floaters and flashing lights, and also why it's important to do routine dilated exams. And thanks for watching. Hopefully that clarified some of the questions you had about vitreous detachment.